Welcome back to the 2020-21 school year. We're excited to get our students back to in-person learning, but things may look a little different than in the past. The following video will provide some tips on best practices in keeping yourself and your students safe and healthy. We will cover personal protective equipment, or PPE, guidelines for different procedures and personal care that you provide to students on a daily basis. First, let's outline the basic PPE that you will wear in the school building. Masks are required for everyone, staff or student, that is 2 years of age or older at all times during the school day. Only those that cannot medically tolerate it or are unable to remove it themselves should not wear a mask. Masks have been shown to be effective in reducing the spread of the virus. Cloth face coverings are masks made from material that are meant to cover your nose and mouth and is secured under the chin. These should be washed on a daily basis. Surgical mask is the term used for masks typically worn by healthcare professionals, but now is required for school staff to utilize as well. These masks are considered disposable and should not be worn for longer than 1 day. A mask with a visibility window is a great option for staff or students who need their facial or mouth movements seen in order to best communicate. These masks are also considered disposable. Face shields are combined with a mask, and they're recommended to protect staff from students who cannot control secretions, including sneezes, coughs, and forced expiration of breath or spitting. A face shield is not a substitute for a cloth face covering or a mask. Face shields should be combined with a mask when interacting within the 6-foot physical distance. A face shield should extend below the chin anteriorly to the ears laterally, and there should be no gap between the forehead and the device frame. Face masks are reusable and should be cleaned at the end of every day. Goggles are another option to replace the face shield if you find that more comfortable. Other basic PPE available to you are gloves. While wearing gloves is not a substitute to meticulous hand washing, gloves should be worn when there is possible contact with respiratory, blood, gastrointestinal fluids, or other potentially infectious materials. Also wear them when touching another person's mucous membranes or non-intact, broken skin. Remove after using and before touching non-contaminated items and surfaces, and before going to another student. Wash your hands immediately after removing them. Washing hands between students prevents cross-contamination. Also wear gloves when wiping down surfaces or equipment. Gowns can be a lab coat style jacket worn to protect skin and prevent soiling of clothing during activities that are likely to generate splashes or sprays of blood, body fluids, secretions, or excretions. It should be washed at the end of every day or more often if it becomes visibly soiled. You do not need to change gowns between students unless it becomes visibly soiled, and you might want to consider bringing an extra change of clothes to keep at work if you get particularly splashed or sprayed. Next, we'll talk about specific PPE for various procedures or personal care that you provide to students every day. Refer to your handout to reference the specific steps for each procedure covered in this presentation. First is oral feedings. You should wear your gown, gloves, mask, and face shield or goggles. Next is gastrostomy feedings. For this activity, you should wear gown, gloves, mask, and face shield or goggles. Appropriate PPE for handling student oral secretions is gloves, gown, mask, and face shield or goggles. Consideration must be made to wash students' hands frequently if they tend to put their hands in their mouth. When diapering, appropriate PPE is gown, gloves, mask, and face shield or goggles. If doing a stand-up diaper change, use the same procedure and assure equipment is cleaned or disinfected. When toileting, appropriate PPE is gown, gloves, mask, and face shield or goggles. One student at a time and one staff, if possible, in the restroom at a time. Continue wearing your PPE throughout toileting and while flushing the toilet. Disinfect the toilet seats between each student. When proceeding with urinary catheterizations, appropriate PPE is a gown, gloves, mask, and face shield or goggles. Next, we will cover the aerosolizing procedures that some of our students require. These procedures include tracheal suctioning, nasopharyngeal suctioning, oral suctioning, tracheostomy care, open suctioning, CPAP, cough assist, or nebulizer treatments. These types of procedures require a fluid repellent gown, an N95 mask, gloves, and face shield or goggles. It is also recommended that these procedures are completed after moving the student to a separate room or area, if possible. Providing nebulizer treatments also requires a fluid repellent gown, an N95 mask, gloves, and face shield or goggles. Again, it is recommended that this procedure is completed after moving the student to a separate room or area, if possible. Families should be encouraged to connect with their healthcare provider to see if they can instead provide the school with a metered dose inhaler for their student instead of a nebulizer. When providing basic medications or treatments, appropriate PPE is gloves, mask, and face shield or goggles. Be sure to follow your medication training rules and the 6 rights of medication administration. When cleaning surfaces or equipment, appropriate PPE is gloves, mask, and face shield or goggles. The general rules in regards to cleaning are wipe down frequently touched surfaces at least every 4 hours, and use only the products the facilities department provides, keeping in mind that proper disposal of cleaning wipes is in the trash, not the toilet. If possible, students can also help in wiping surfaces that they have touched or equipment that they have personally used. PPE is not required in that circumstance, but they should wash their hands. Remember, wipe down frequently touched surfaces every 4 hours. Use only the products the facilities department provides. Wear gloves, mask, and face shield or goggles when cleaning. Also, a note about cleaning face shields or goggles. Using the cleaning products that are provided is appropriate, but some may leave a residue on the plastic surface that can easily be rinsed with clean water. Lastly, a reminder to wash your hands with soap and water frequently. While hand sanitizer is also an option, scrubbing your hands with soap for 20 seconds and rinsing with water is the most effective way to eliminate bacteria and viruses from your skin. Work with your students to include hand washing in all aspects of your school day. There are lots of great videos and songs that your nurses can provide to promote fun hand washing times into your day with the students.